Well, greetings and welcome to Parker University. We have two distinguished guests here with us today, Dr. Geoffrey Bove and Dr. Brian Budgell.
Thank you.
Both PhD DCs, and their expertise is in neurophysiology, and it's been an honor to have you at the campus today as we've worked on hopefully some potential collaborations. Geoffrey, could you tell us a little bit about your background?
Well, I went into chiropractic. I got interested in going into chiropractic healthcare in the early 80s. I had been a injured professional ballet dancer for a very short period of time, and I thought I'd be the chiropractor to the ballet stars. That didn't go well. I ended up entering private practice in North Carolina in the late 80s, and soon after I decided that I wanted to pursue a degree and do research and be an anatomy professor. And so I did that through the University of North Carolina in Chapel Hill. And then I've been pursuing a career in academia and research ever since then.
Very good. Dr. Budgell.
Yeah, I was, introduced to chiropractic through a martial arts injury and had a good response to treatment and had it in the back of my mind that that might be an interesting thing to do with my life. I had been an educator in healthcare and eventually decided that chiropractic was what I wanted to do with my life. Went and enrolled at CMCC, and the rest is hysteria.
Hysteria. So, and where are some of the places you've worked and some of your research background and study background?
I was very fortunate that after spending some time in practice in Toronto, I had my own clinic for about 6 years. I was able to go to Japan for what I thought was 1 or 2 years to work in a very fine laboratory there. As you understand, it turned out to be 14 years after all. But during that time, had access to wonderful resources to investigate primarily somatoautonomic reflexes.
Yeah, how about you, Jeff? You had an interesting path as well.
I kind of fell into the University of North Carolina at Chapel Hill because I was practicing nearby. I didn't know that it was a world-class research institution, and I didn't know that my research grandfather had coined the term nociceptor. So I was working with people who were far more qualified and, I hate to use the word, I guess, pedigreed. But that pedigree wore off a little bit on me, and I was able to break a ceiling in being the first chiropractor to be faculty at Harvard Medical School, which was difficult as a chiropractor to do that. There was some reticence to me, even as a PhD, as a neurobiology researcher. But just struggle on and be persistent, and things go often the way you want.
That's awesome. Very interesting background. Now, how did you get involved in neurosciences?
I was always interested in pain mechanisms, and from the clinical standpoint, I didn't understand with my what I consider an outstanding education from CMCC as well. Brian and I were a year apart at Canadian Memorial Chiropractic College, so I wanted to learn about the basic physiology and the sensory systems, which starts with nociceptors. That's the first pathway, the first signaling on the way to the perception of pain. So that's what I've been studying.
And I understand, when you started college, Parker didn't exist. Otherwise, you probably would have applied here.
This is very true.
Yes.
Yeah.
So, by the way, I always refer to these doctors as the most underappreciated researchers in chiropractic, because mainly you do most of your publishing in more medical-oriented journals. Is that true?
Or basic
science journals?
Basic science journals. Mm-hmm.
So we've had some interesting discussions today, even talking about the effect of spinal adjustments on organs. Mm-hmm. Brian, you want to fill in some of your work on that topic?
Righty. Well, the reason that I got interested in research to begin with was that first as a young intern and then as an early practitioner, some of my students, some of my patients recovered quite dramatically from what appeared to be visceral complaints as a result of the chiropractic treatment. And I wanted to understand how that could be so. And that's why I ended up going to Dr. Sato's lab, because they were specialists in the neurobiology which is thought to underlie that sort of phenomenon. So I went off to Japan, and primarily used a model of back pain. We induced experimental back pain in rats, and then studied the responses in the autonomic nerves and then in the organs which were served by those nerves. And in fact, the general pattern of what we found was quite consistent with what chiropractors have espoused for some time.
Very good. So what's the relevance of neurosciences to chiropractic and clinical practice? What are the things that you're foundational scientist? How does that become relevant to me, the clinician?
I think that the foundations of neuroscience form the profession.
For me, I've got to be able to talk to my patients and also to my colleagues in other professions to explain what I do. You understand that these days, unlike when you and I graduated, nobody questions that chiropractors can fix neck pain and back pain. That's done. When we're criticized these days, it's because of what people perceive as the lack of science supporting the profession. So for our cultural authority, it's tremendously important that we be able to articulate what we do.
Do you think most chiropractors can articulate the science behind chiropractic?
Good heavens, no.
Good heavens, no. Now, are we bone doctors or nerve doctors? Jeff?
Trick question.
Yeah, I thought I'd throw that in there.
No, we're nerve doctors.
We're nerve doctors.
Period.
Yeah, I agree.
We leverage bones to our advantage.
Yes, that's good. And we talked a little bit about expanding the neuroeducation of chiropractors, maybe postgraduately. Any concepts or the vision of that? What is your vision for chiropractic to get the basic science into the hands of the chiropractor?
Well, the very fundamental basic science can be used on every patient. The fundamental neuroscience principles of how the sensory system is working and how the autonomics are working should inform and lead your diagnostic questioning and exam, and finally diagnosis and approach to treatment of each patient.
Mm-hmm. Absolutely. And I can recall when I was starting out in practice, I would have my Guyton's Physiology or my Candle and Schwartz textbooks open every week to help me understand what was going on in my patients and to help me make better decisions.
Very good. And what's the best way to move forward at this point?
To move this profession forward?
Yeah.
Be smarter. You know, we're really good with what we do with our hands, but we don't understand what works and why it works. And if we are like that, if we only continue to practice what we have already done, then we remain a type of folk medicine. There are certainly problems with conventional allopathic medicine, but we should learn from their strength, which has been that they break down and they analyze what they do, they look at what works and what doesn't work, and they build on those strengths to improve treatment. And of course, the development of antibiotics is a good paradigm for that. We started with penicillin, but by understanding how penicillin works, it opened the door to so many other more powerful treatments. We need to be doing that with our techniques as well.
I agree. And we talked earlier about at the time chiropractic was discovered, the philosophy of all health professions were trying to get a reductionist view of what caused disease, and taking that into the concept of when it happened, when chiropractic was discovered, really shows a lot about BJ or D.D. Palmer, how he moved forward. Any ideas or any thoughts on what the world was like when chiropractic first was discovered?
The scientific world of that time?
Yeah.
As Jeff has suggested, it was the age of unifying theories.
That's right.
So there was the germ theory, which for the medical profession became almost a unifying cause of disease. We had shortly before that atomic theory, which was the unifying theory of matter. We had the periodic table, which provided a single context within which to interpret the behavior of chemicals. So it was a time when people were looking for the one big answer for many challenges. So the fact that D.D. came forward with what he saw at the time as a unifying cause of disease was not an outrageous thing for one man to do.
And certainly in the context of the time, in the context of the best available science, it was a reasonable theory that he came up with.
Well, the science which he espoused was in fact conventional medical thought. He did not invent the term subluxation. He did not invent the term adjustment, and he did not invent the term chiropractor. All of those terms were in use prior to his birth.
So
Prior to his birth?
Yes.
So 1820,
1820s, yeah, you can see subluxation and adjustment and chiropractor in the literature.
I
haven't
learned
seen that literature.
something today. That's amazing. So have we, as from that time, there's some chiropractors who would stick with the green books and not want to move forward. What do you think we should how should the model for subluxation and chiropractic progress?
Well, I think we should go back to the green books and start there and mine the green books and the early concepts that underpinned chiropractic. And you have to remember that there was no biomedical research related to chiropractic ideas. There almost isn't any now. I mean, it's been it was difficult to get the funding to do the research. It was difficult to find reviewers to review the applications that were coming into the National Institutes of Health up until very recently. Even now, it's difficult. But basically, we're 100 years, 75 or 100 years behind in chiropractic research. So might as well go back and start where we should have been able to.
Start back. But you're foundational researchers too. You start
Right.
You start at the base and you working forward. I'm a clinician. I usually read clinical research. Some of the stuff you write's maybe a little bit over my head. But it's my goal to get your names more out there so people understand how important that research is and at the level that you're publishing and the level of you're researching. So what are the basic sciences say about the chiropractic management of visceral disease?
That's actually a very long question, isn't it? Because there are
That's
many
about
patients with
12
many
words, yeah.
visceral disorders. It's a complicated matter. But the early observations of the first chiropractors were honest observations. They may have used a different vocabulary, but they weren't lying about what they saw, or at least I don't believe that that's the case. So we should take those observations and investigate them and update our concepts using the modern lexicon.
Mm-hmm.
So you know D.D. Palmer's first patient?
Yes.
Who had a hearing problem.
I'm sorry?
And his second patient had, but that was the patient who led to the founding of chiropractic. The second patient had cardiovascular disease. And when you read D.D. Palmer's text, he talks about then it occurring to him that here was a pattern, that spinal disease led to visceral disease. And he was fundamentally correct. It is the case. As you and I understand, this can't happen in every patient all the time. But there are clearly patients in whom visceral complaints do originate or certainly facilitated by biomechanical disorders of the spine. And chiropractic is often a very good treatment option for those patients.
Very good. Now, we've talked earlier about the progression of science, how we really need to lay the foundation and build upon the foundation. And we've seen certain scientists that they'll have research that they'll extrapolate, they'll have a small N in their research, and they'll extrapolate miles down the road of how beneficial that was, basically skipping several steps.
Mm-hmm.
And sometimes that's damaging. Any thoughts on that you'd like to share? What are your...
The two of us are pretty classical basic scientists, so it is irksome would be a good word when we try to be very, very clear about what we know versus what we think. And it's not always the most comfortable approach for people to accept. In fact, it makes people very uncomfortable to hear that nobody knows the answer to their question. But to us, that's kind of usually just forms a challenge. If there's observations and we don't know how something's happening, our job is to develop investigative tools to address the hypothesis that those observations can generate.
Now, what could I do at Parker to help generate the next generation or create the next generation of chiropractors who are going to be able to understand the science and apply that to their practices?
Mm-hmm. People take science much too seriously, and are looking to it for for too many answers. Science is the endeavor of asking the questions. And we have to teach our young people to be comfortable with the uncertainty and to be comfortable in the pursuit of knowledge rather than the achievement, the idea that it's a journey, not a destination. And to enjoy being out there at the frontier when you don't know stuff, that's the most exciting place to be. And I think one of the thrills that both Jeff and I have both enjoyed is 2 or 3 o'clock in the morning, knowing that you're the first guy in the world to understand something that you've just observed on an oscilloscope or through a microscope.
Might be an arrogant thing, but it's usually our first thought, if we have one of those aha moments or we've discovered something, is who can I share it with?
I just made a discovery that no one else in the planet has ever realized. That's pretty exciting. And you said, Brian, something interesting. People want certainty. Certainty, I find, is every student here wants the certainty. I want to know this is the place I need to adjust, that this is the best technique, that this will get the results. And there's people out there who give them certainty.
Yeah, it's a shame.
Sadly true, yes.
And yeah, you guys get it. Not everybody, when I have this talk about certainty, not everybody understands what I'm talking about. If I'm the guru who says, Jeff, if you do this technique and you do it to every patient and you do this, you'll get this result both physiologically but also monetarily. That's attractive. What I want to create is people who live, my students, who they can live in uncertainty but have confidence. There's a difference. Self-confidence and certainty are two different things. Certainty is the enemy of curiosity. As a scientist, you understand the value of curiosity, and that every morning when I get up, first thing I do, I hate to say it, I get up and I'm kind of digging in, and it's social media, but we're discussing some of the research articles. Like 4 a.m, I'll be getting up and doing stupid, but also the curiosity that of other chiropractors not to fall into the trap of seeking certainty or to the self-arrogance of acting like we know more than we do.
Well, you've said it is a trap. People should recognize that. You should be able to smell that out.
So
thinking's hard work too.
I heard that. So any questions you want to ask me or each other?
What brought you to Parker?
Oh, it was awesome. Well, my background is clinical chiropractic, and arguably I kind of may have reached the high water mark for chiropractic. I worked in a tertiary care facility. I was on the some boards for the Navy for musculoskeletal care. Took care of the White House. Is the White House chiropractor. Was the chiropractor to Congress, and pretty much had done that for a number of years. And I hadn't seen the rest of the profession rising up there. And I thought, you know what? I've done this. I'd love to go back and share this with students and share it with the rest of the profession and bring everybody along.
That's wonderful.
And yeah, I'm a clinician. I'm not a scientist. I'm not an educator, but I know what a good chiropractor should look like and what tools they should have. And I want to replicate good chiropractors. And as our discussions, you realize that I really have a desire to expand our knowledge of neurology.
Well, Parker's lucky to have you.
Oh,
I think that every chiropractor should be a scientist.
Well, it's part of the complete practice.
Right. I think that every chiropractor should, when they have a question, I think they should go consult the published literature, and if they don't find an answer, just beat it. But it's not, beat it down and maybe call people and share information, which social media is, sometimes that's a good thing, sometimes that's a bad thing. But it does help collective experiences or data.
Yeah.
Right.
It is. It's and you're truly right. It's learning every day. Coming in, the patient shows up. I don't know what's wrong. And then to research, take it upon yourself. That's my project for today. I'm going to treat all my other patients, but today I'm going to find about myasthenia gravis or whatever that thing is, and that I don't know about, or I've learned in chiropractic college, but it's fallen behind. Ehlers-Danlos. At one point I started seeing a lot of Ehlers-Danlos patients coming through my clinic. And it's a rare condition, but I'm seeing lots of them. So I took it on myself to learn everything about Ehlers-Danlos. And we've talked about that. It's one of those things, that connective tissue disorder, that chiropractors should be aware of that. And now I have a pretty good understanding of that and what we should do, what we shouldn't do. And if every day you're moving forward, you're getting to be a better doctor. Now, they've done studies that show medical doctors, and they've done several studies that they've monitored their ability to practice evidence-based practice over their lifetime. And most of them at the highest level the day they graduate from their residency program, and it decreases till they die. And with rare exceptions, unless you're in a teaching hospital or you're actively seeking knowledge, we're all on a descending course.
Mm-hmm. My kids
I
have
hope
told
I'm
me I'm
not.
getting stupid. Yes.
You're getting stupid. No, yeah, I'm sure present company excluded. But
like Ehlers-Danlos is a great example, because I did the same thing a few years ago, because hypermobility is present in a lot of our patients. And then you find out that that particular diagnosis has 8 or 9 subtypes?
10.
10?
It depends. Some authors at 6, some is 10.
Right, so 8 or 9?
I guess, right?
No, okay,
yeah.
but there's no way that clinically you're going to differentiate those, because there are genetic differences. But knowing that, I didn't know that 10 years ago.
No.
So I went out and I said, well, look at that. I wonder. And the answer's out there for me.
And with it, I was just talking to some students in the clinic yesterday, and they were going over Ehlers-Danlos. So there's more conditions out there, but the idea is, once you get the hang of it, you're looking at, they have blue sclera, do they have a high palate, do they have crooked teeth, is the Beighton score 6 or higher, and to have that in and what can I do about it, and what shouldn't I do, and then it also produces more curiosity. Are these the patients that could be getting the vascular dissection, their vertebral artery dissections, because they have increased fragility of their vessels and increased orthopedic mobility? And as we run down that rabbit hole, as a clinician who has been out of school for 30 years, going back and learning that, and hopefully being back up to date with this on that one aspect of care.
Mm-hmm.
Yep.
But it also, when you do that kind of inquiry, looking for yourself, you also tend to revisit a lot of other information that you may have forgotten about. Like, for instance, who's the other group of people that we were taught are more susceptible to vertebral artery dissections? Are the people in the 30s to 40s age group, where they're gotten relatively hypermobile because they're getting older and their holding elements are weaker. So they haven't reduced their range of motion by osteophytosis so much, so they're considered at risk, but that's what the Ehlers-Danlos people are genetically. So you review. My point is, it's a good example of how you can review a lot of other things at the same time, and basically taking an inventory of your own knowledge is really.
Yes, and one thing leads to another, and
Yeah.
the discussions, and then the next day somebody else comes in,
Right.
and they have a different condition, or they're not responding. So it's the ability, and with it, this is where I know we talked. You're not crazy about social media. You're more like into.
I'm not mature enough for social media.
Oh, you get screaming and yelling. Oh, you dirty! No, but it is. There's a lot of arrogance and self-righteousness that's shared on this, and
Surely not.
oh, it's truly and it's misplaced, and it's usually you didn't know this, you dummy, and there's so many levels to knowledge that you'll have people who are like, you don't know what you don't know, and frankly, it's the more you get into this, I hope you get more humble as you get deeper into the science. For me, it's the further I get into this, it's like there's less and less that I really know, so that I have less certainty, I have more curiosity. Hopefully, it doesn't affect my self-confidence.
Mm-hmm.
So, any other pearls of wisdom before we move on? So it's been a joy to have you.
I'll try to think of one.
Oh, so who's been your big inspiration in chiropractic or in
Mike
research?
Wilds.
Yeah,
I'll tell him every time.
Oh my goodness!
Every time I see him, I'll tell anyone. He was a formative. He was had the most impression on me and my career and what I've wanted to do and why I've wanted to do it. And it was a simple principles and practice course that he taught at a level that is probably not taught at all in the chiropractic profession any longer.
Wow. How about you?
Now,
Ryan?
I didn't know Jeff when I went through CMCC, because I had a couple of kids and I was pretty caught up with that. We weren't in the same class, but I would have said the same thing. It was Mike Wiles who introduced us to chiropractic principles, introduced me to Dr. Sato's work, and interestingly introduced Dr. Sato to me.
There you go.
That made the connection, which led me to the lab.
One person led you guys to your life's work. What was it he did? What was the thing that he did that that set the fire?
He was excited about the tenets of chiropractic from a sane standpoint.
So he liked chiropractic, but he didn't want it. He didn't want the crazy.
There actually was very little crazy. He taught us from a balanced view what the neurobiological mechanisms, how little we knew, but what was proposed. He was not partisan, I guess is the right term.
Mm-hmm.
He didn't care where the information came from, medical, osteopathic, the Kellogg Foundation, chiropractic, whatever. He just taught us how to differentiate theories from, facts from theories. And I don't think very many people paid attention in that class.
Apparently two
But
people
a few
did.
of us did. And it made us, basically, I think that triggered us. I think I would probably ended up a lifelong kind of learner. I guess that's the thing. But it triggered me into knowing and where I wanted to go and what questions I thought were important.
Lifelong learner. Today, you guys spoke to our Neuro Club here at Parker's campus. Great lectures, and your model for visceral dysfunction, drawing it out there, it was brilliant. It's simple. I wish we could show that to the audience watching this, but it was really good to show validating chiropractic to our students, but not doing it through an oversimplified model.
Brian and I actually study the same thing for the same reason, just with slightly different approaches, and they're very complementary. And why, I don't know why we haven't actually had most of our career together, but we've tried a little bit more.
Oh, we're
There's
working
still
on something
time.
now.
Yeah, you guys have time.
There's still time.
Well, you've established yourselves. I'd love to learn more about it. I'd love to learn more about how the chiropractic adjustment affects the organs.
So would we.
Oh my gosh, it's. But the thing is you're validating chiropractic. You're just not overstating your research.
We try not to, or I try not to.
Yeah, I don't think we set out to validate anything. We've challenged some of these basic concepts which Mike introduced us to, but I would have been just as happy to disprove the stuff, which in fact we seem to be supporting.
You're seeking truth.
That makes me sound like a better person than I actually am.
Facts. You're answering questions.
Answering questions.
Well, thank you both for visiting Parker today. We've had a great time, and I just so grateful that you would take time out of your busy schedule to come visit us.
It's been eye-opening in a very, very positive way.
Oh, good.
Yeah, thank you very much for having us.
You're welcome. Blessings to you both.
Thank you.